Thanks everybody for sticking out until the afternoon. So let's talk a little bit about all these endocrine diseases and of course laminitis. So the reason why we care about endocrine diseases primarily is not just because they make an animal generally unhealthy, but we have this complication of laminitis, which is potentially devastating for the animal. And so everybody's familiar with laminitis from a variety of different causes. So obviously we're going to talk about endocrine diseases in this presentation, but I'm sure you guys have heard about horses that colic, or donkeys in this case, equids that colic, and they develop founder as a result of that, and all sorts of things like this. So certain things are unavoidable, but what we know from some survey studies is probably up to 90% of laminitis is actually due to endocrine disease. So if you're talking about the kind of laminitis that happens as a result of a colic or a bad surgery or retained placentas and stuff like that, those things you can't necessarily, those are bad luck type situations. But because 90% of laminitis is due to endocrine problems, it gives us a pretty big window of cases where we can hopefully intervene and head that off, right? So prevention is the key to laminitis, because every time the animal has an episode of laminitis, even if it's very mild, there is cumulative damage within the hoof structures. And this can accumulate over time and be subtle enough, especially in an animal like a donkey. So say this animal's a pet, it doesn't really work, it sits out in the field, you may not notice that there's a little bit of foot soreness. And this happens over and over again for a period of months to years. And what we find is at the time of diagnosis, many of these animals already have evidence of laminitis. So if we can recognize these cases earlier and step in and prevent that, that's the key to managing it. Sometimes, obviously, they get enough cumulative damage that it ends up being crippling to the point where the animal has to be euthanized, and we don't want to get to that situation. So let's talk a little bit about hoof anatomy. So this up here is, it's actually a little bit of a laminitic hoof because you can see some divergent growth rings on here. But for our purposes, this is the way the hoof looks externally. And what I wanted to do is just make sure everybody is familiar with laminitis and the laminar anatomy so we can talk about this, throughout the course of the presentation. So if we look over here, we have this radiograph. Inside, this is the coffin bone or the distal phalanx. And this is the hoof capsule around it. So you can kind of imagine this superimposed on there and see where these structures lie within the hoof capsule. And holding all of this together is this delicate laminar tissue, which is basically little sheets of tissue with interdigitating fingers in it, okay? And so there's just the hoof wall peeled off. So the only thing tying this hoof capsule to the underlying bone is this little delicate network of tissues. So you can see if anything damages this, why that hoof will tend to start, the bones will actually shift within the hoof capsule and rotate or sink, okay? So when we look at this under the microscope, what we see over here is healthy laminar tissue. So you can see these long fingers basically are those sheets that you remember from the previous photograph. And then there we go. And then each one of these interdigitates with these fine secondary lamina. And so when we're looking at the right-hand side of this, this is a horse that has endocrine laminitis. And so what we can see is that the tissues have been disrupted and weakened, and can everybody appreciate how they've been stretched out? And so that's not normal tissue anymore. That's weakened laminar tissue that it allows the bones and everything to shift and rotate within the hoof capsule. So the way the mechanics of the footwork is that there's the animal's weight here at the ground surface, and that's transmitted up through the hoof capsule and then across the laminar tissue. So there's only this little bit of laminar tissue anchoring this coffin bone to the dorsal hoof wall over here, and all the way around to the hoof capsule. And then the weight is transferred to the coffin bone, and from there it goes up the bones of the leg, right? Now there's a big tendon called the deep digital flexor tendon that runs along the back of this limb. And so there's a pull in this direction from the deep flexor tendon. And the only thing counteracting the pull on the bones of the deep flexor tendon is that network of laminar tissue, right? So what happens in a hoof like this, we have a normal horse here on the left and a horse with laminitis here on the right. In the normal animals, the coffin bone and the dorsal hoof capsule should be parallel to one another. But if you have that deep flexor tendon pulling and there's nothing to counter that in the opposite direction, in other words, the laminar tissue has been weakened and stretched out or destroyed, then that's the situation where we get this coffin bone actually rotating within the hoof capsule, sometimes to the point where it can poke through the bottom of the foot over there. You know, we've all heard those horror stories. Those are nightmares to deal with when they happen. Those are the types of cases that frequently end up being euthanized because it's very difficult to correct that situation. So that's why you get these divergence in a lot of the pictures I'm going to show. You know, you're going to see that the hoof capsule over here is no longer parallel and aligned with the coffin bone underneath. So there's two diseases that we're going to talk about. Equine Metabolic Syndrome is one. It's important because it's quite common in animals of any age, including young animals. And then equine Cushing's disease, its technical name is Pituitary Pars Intermedia Dysfunction, and that's a disease of aged animals. So usually animals that are about 10 years of age into their teens, 20s, and older. So those are the two endocrine diseases that are most common and are most commonly associated with laminitis, and also with general ill health. So they're important because, again, they're common. There's some studies, and I'm going to talk a lot about horses in general, but you can substitute horses and little ponies for donkeys. A lot of this work, I think ponies and donkeys are very similar, and so a lot of this work on laminitis research and stuff has been done in ponies, and so I think it translates very well to horses. But in some of these studies, what we've seen is that up to 50% of equine populations are overweight or obese, right? So we know that in humans there's an obesity epidemic, and that's actually mirrored in cats and dogs and in horses. So our populations are generally overweight. And this is associated with metabolic syndrome, and we'll talk about how in a minute. But again, very common thing that can happen. And then about 30% of aged animals 10 years and older will develop Cushing's disease. And so of those 30%, probably a third of them or so have problems with their metabolism, and those ones are especially prone to developing laminitis. Both of these diseases can cause metabolic abnormalities, and sometimes they happen together in the same animal. And in those cases, you know, it's a double hit, basically. Puts those animals at even more of a risk of developing laminitis. Okay, so I wanted to talk a little bit about the physiology because I think this is a bit confusing. We talk a lot about insulin and glucose and what these things do in the body. So let's just talk about a little bit about the insulin metabolism system. So basically when food is ingested, there's glucose that's broken down and floating around here in the stomach, right? It exits the stomach into the small intestine and then into the large intestines, and it's absorbed primarily here in the small intestines. At the same time, the pancreas, which is this little lumpy yellow thing over here, secretes insulin, and the job of insulin is to have it promote sugar uptake into tissues after that's absorbed out of the bloodstream, okay? And so this is a little bit of cell physiology over here, but what we have over here is a cell, and here's your bloodstream, and these little things crossing the cell membrane are insulin receptors. Again, this is the nucleus for everybody. Remember your biology classes way back when. And this in here is the cell cytoplasm that houses all the machinery, including channels that are necessary for glucose uptake into the cell from the bloodstream. So when glucose is ingested and then absorbed out of the intestines, insulin is released from the pancreas, and this is a picture of the insulin hormone and its protein structure over there, so a complex 3D structure, and it's basically like a lock and key. So along comes insulin, and it fits like the key into this insulin receptor on the cell membrane, and what that causes is signals within the cell that tell these glucose channels to come out of the cytoplasm and insert themselves up here in the cell membrane. And you can see here in the distance is glucose coming up here to the cell. And then the glucose will find its way into the channels. You know, more glucose is coming along, and it keeps going through these channels. The important point over here is that when insulin is not bound to its receptors, these protein or these channels here in the cell membrane will go back into the cell and not function to take up glucose. The other thing that can happen is when there's insulin bound to the receptor, but there are things here that interrupt this signaling pathway within the cell, it just simply doesn't tell these channels to go up to the cell membrane. And that's that process of insulin resistance. So insulin binds to its receptor, but its signal can't be transferred into the cell, so we call that insulin resistance, because the tissues that should be responding to insulin no longer show their normal response. And again, what should happen is that those glucose molecules get taken up and then converted to energy within the cell. So anything that interrupts this process is what we call insulin resistance. And so what happens when the pancreas says, well, I'm putting out an insulin signal, but glucose is not being absorbed. I keep detecting that there's too much glucose in the bloodstream, so it's going to put out more and more insulin, right? So you get to this position where now we call that hyperinsulinemia, or excess insulin in circulation. And then we care about this because that excess insulin within the circulation actually directly damages laminar tissue in the foot. And the reason it does this is because insulin shares a structural shape similarity with some of the other hormones that are involved in tissue growth and development. And those receptors on the hoof, when there's very high concentrations of insulin, those receptors get activated because insulin looks enough like their own hormones that at high concentrations, it can cause those to become active. And that disrupts the cell's abilities to, if you think about laminar tissue, the horse is always walking around, there's little micro traumas, there's little tears, little injuries that happen. It constantly has to remodel. The hoof wall is constantly growing. Dr. Davis earlier had mentioned apoptosis. That's another process that's all regulated, and all these things have to happen in their correct sequence and at the correct rate. And so when we have this aberrant activation of these insulin growth factor 1 receptors, which is all the other hormone that I'm talking about, that can just disrupt the way these tissues are able to do their growth and development and repair mechanisms. And that eventually leads to laminar weakening, and then just the biomechanical forces of walking around with the pull from that deep digital flexor tendon will then cause the displacement of the coffin bone within the hoof capsule. So again, we touched on this term, hyperinsulinemia, or high blood insulin concentrations. A lot of times because it's due to tissue insulin resistance and the body trying to overwhelm that resistance by putting out an increased insulin signal. Okay, so I want to talk about this whole idea of insulin dysregulation because it is the central hallmark to both of these diseases that we're talking about with their relationship to laminitis. So it's important to remember that there are many genetic factors that can predispose you to developing a disease, and also environmental factors at the same time. And whether or not you develop a disease kind of depends on what genetic factors you inherit, and that combined with your environment, right? So in the case of obesity, there are things that are genetic advantages in certain situations, but not in others. So if you think about donkeys, they evolved in very harsh environments typically, so it was advantageous over millions of years of evolution for them to have genes that allowed them to survive on very low calories and periods of famine. So one of these things is the ability to store fat, so genetic tendencies to store fat. There are also hormones that are released while you're eating that come from the intestines, and they stimulate pancreatic release of insulin. And so there are some animals that appear to have a genetic tendency to put out more of these hormones, which drives more insulin release from the pancreas, and that contributes to a hyperinsulinemic state, right? So these are all genetic things that can be the underlying factor. What we don't know for any individual animal is what genetics that they inherited versus their environmental risk factors, right? So if you start off with a threshold over here with your genetic factors, and then you layer on top of that obesity and a high sugar diet and all sorts of other things, at some point they tip over the edge and then develop metabolic problems. But if you can take that animal that may even have some genetic predispositions, but not let it get obese, not feed it a poor diet, make sure it gets its exercise, you may be able to avert that process, okay? So equine metabolic syndrome itself, its hallmark central tenet is this insulin dysregulation that we've been talking about. It's also associated with obesity, and we'll get into that in a second. And it's usually generalized obesity with some regional adiposity, which is these fat deposits over the neck and parts of the abdomen and the tail head and things like that. What I wanted to point out, however, is that there are a subset of animals that look normal, that don't necessarily have this obese appearance to them, that may also, they're called lean EMS animals, right? And so they may still have EMS even if they don't obviously look like they have this phenotype. But typically, it's something that's closely related to obesity. And the third hallmark of equine metabolic syndrome is laminitis. And like we said earlier, sorry, my voice is cracking over here. Like as we said earlier, a lot of these animals at the time of their diagnosis of equine metabolic syndrome or of Cushing's disease already have evidence of laminitis if you take x-rays of their feet. So typically these animals with metabolic syndrome are young, horses, ponies, donkeys, everything can be affected by this condition. You'll typically refer to them as the easy keeper animals that can basically exist on nothing. Again, generalized obesity, usually with some fat deposits, but just because an animal is lean, it may have internal fat deposits that cause problems for it that are not readily visible on the body surface and things like that. Sometimes these are animals that were previously obese in the past and have now lost weight, and their metabolism doesn't necessarily return to normal once it's already been deranged by being obese in the past. So sometimes you'll see them with lumps and bumps everywhere. People sometimes send them in to us because they think they have a tumor or something, mammary swelling or swelling around their sheath, and it turns out to be nothing but fat deposits. So sometimes the first complaint is laminitis. And unfortunately in donkeys, because they're kind of stoic animals, you know, it may be pretty advanced laminitis and pretty chronic by the time you notice that. So here is your typical EMS animal. Sorry. So this one is one where it has, you know, fat deposits on its neck crest to the point where the neck crest has fallen over to the side. So that's pretty obvious, right? Here we have this, almost to me looks like a photoshopped image, but unfortunately it's not. That really, you know, they really do get that fat and have lumps and bumps all over their body. We've probably all seen donkeys that look like that. So again, this is your classic EMS animal right here. So why is obesity bad? And why is it so closely tied to metabolic syndrome? Well, if you think about it, the body, a lot of body systems rely on energy from the adipose tissue. So it makes sense that the adipose tissue, which is fat tissue, has developed ways to signal to the rest of the body that it has, you know, how much reserve it has, right? And so one of the things that it crosstalks with is the immune system. And so when you have your normal, happy fat cells that are not storing too much fat within them, they secrete a certain hormone profile, right? When those fat cells become heavily laden with triglycerides and they become overwhelmed with that, they get really stressed and they send out a lot of stress signals. And everybody's familiar with inflammation being a bad thing. I mean, it does have some physiologic good properties to it, like we heard about with the wound healing. But this body-wide inflammation that happens when fat cells are stressed and they're sending out all sorts of inflammatory mediators. Remember how we talked about insulin resistance interrupting that signal between the insulin receptor and these glucose transporters? Those inflammatory mediators are one of those things that interrupts that signaling, so they cause insulin resistance, right? And then, of course, you get the pancreatic compensation and hyperinsulinemia. Obesity also causes problems in the liver. And when insulin is secreted from the pancreas, the liver is the main organ that then goes ahead and clears it from circulation. So if there's a lot of fat, you know, metabolism derangements, and I should point that out too, insulin also has similar effects in fat as it does to glucose. So it promotes uptake of fat into adipose tissue. But when that insulin signaling cascade is disrupted, you end up with higher circulating blood levels of fat, and those triglycerides eventually end up within the liver and can cause, usually it's a mild degree of liver dysfunction that then can impair the ability of the liver to clear insulin from the circulation. So again, another thing that leads to hyperinsulinemia. Because of these genetic factors, obesity is probably more dangerous in certain breeds than in others, right? And so again, little ponies, donkeys, things like this that are developed in thrifty environments and already have genetic risk factors, and now on top of that, are allowed to get obese. Now they have multiple risk factors for the development of hyperinsulinemia, which can then damage their feet. Okay. So unless you're a Poitou donkey, you're not supposed to have hair coat like this, okay? So if everybody can recognize that that's abnormally long hair, that is a hallmark of equine Cushing's disease. The astute observer will notice that that's a horse over there, so let's fix that problem and put some ears on him. The reason I put that up is because it's such a classic picture of a Cushing's animal with that curly abnormal hair coat that it's just, a good mental picture to have. So what is Cushing's disease? There's a little gland at the base of the brain called the pituitary gland. And within the pituitary gland, there's a section called the pars intermedia, and its basic premise is that it helps change metabolism in preparation for the winter months when there's going to be scarcity in food. And so it becomes active, especially during that time of the year, and puts out a lot of hormones that help with metabolic shifts to compensate for that lack of food and changes that have to occur during the winter. So sometimes this section, the pars intermedia, will develop a tumor. And then that tumor doesn't respond to its normal signals, so it starts secreting a lot of hormones that can then change metabolism, but not at the times of the year when they're supposed to, right? So this can then just alter metabolism all the time, and the worse and bigger that tumor gets, the more abnormal hormones it puts out, and the worse there's dysregulation of metabolic processes. So about 30% of these animals with Cushing's disease have outright hyperinsulinemia and insulin dysregulation. And again, just like with metabolic syndrome, a lot of them already have insidious onset laminitis by the time you make your diagnosis of Cushing's disease. So if we look at this diagram of the pituitary gland, this area in here, number 2, is the pars intermedia. And it secretes a lot of hormones, the most important one of which is adrenocorticotropic hormone, or ACTH. And it also secretes a number of other hormones as well. But just recognize that this is one of the hormones that we test for in order to diagnose this disease, because when there's a tumor here in the pars intermedia, there tends to be too much ACTH circulating, right? So typically these are animals that are older, but I will think of this disease in any animal generally 10 years of age and up. But it's, these type of aged animals where you want to be thinking about Cushing's disease. That long hair coat is called hypertrichosis, and it's the only thing that causes, the only thing that causes that long hair coat is Cushing's disease. However, not all animals that have Cushing's disease have that long hair coat, right? So that tends to be quite advanced disease when you're starting to see hair coat changes. And what we need to do is get better at recognizing these Cushing's animals prior to their development of a long hair coat and looking like your typical Cushing's animal. They can be underweight, normal weight, or overweight. So they can present in any way like that. Muscle wasting is a feature of Cushing's disease. And so a very common first complaint that owners will call the veterinarian out for is weight loss. The trick with this is that we're also talking about old geriatric animals, and so they can have a lot of causes of weight loss. So Cushing's disease should be on the list, but don't neglect looking for other things like kidney failure, heart disease, or anything else that can cause an older animal problems. But again, if you look for all of that and rule it all out, and then Cushing's disease looks like it makes sense, it can definitely be one of the reasons for this weight loss or loss of muscle mass. Laminitis is its most severe complication, and this appears to be highest in those subset of animals that have the insulin dysregulation. There's also other things that go along with Cushing's disease, including immune suppression, high worm burdens, skin infections, things like that. So it's one of those things that should be treated just for the premise of general well-being as well. Some of the other things you might see is excessive sweating, lethargic attitude. If it's a breeding animal, sometimes infertility has been related to endocrine problems. Sometimes if the tumor is really big, they can actually seizure from that. That's a very rare thing to see, but it does happen on occasion. Excessive thirst and urination, that's a very common one that goes along with Cushing's disease for multiple reasons. Poor wound healing, again, their immune system is compromised. And if you ever have a mare with persistent lactation and it's not supposed to be lactating, right, i.e. it doesn't have a foal on its side, this is actually one of the things that can come about because of all those abnormal hormones that are released by the pituitary gland. So abnormal lactation is one of those clinical signs that should trigger, oh, I wonder if this animal has Cushing's disease. So I just put this up to kind of show the frequency of the various different clinical signs, but the key to this chart over here is that these are all studies that were done in animals that were severe advanced Cushing's cases, right? And so in these severe cases, it's pretty much expected that you'd find a lot with these hypertrichosis hair coat abnormalities. Again, muscle wasting is a typical thing. Chronic laminitis is present in a lot of them. Increased urination, sweating, abnormal fat deposition. But the thing is, we're talking about animals that look like this. So there's not much question at that point that that animal has Cushing's disease. What we want to do is catch them when they look more like this situation here on the right side. So we have an animal that maybe has a little bit of muscle wasting along its top line. You know, it does not have the abnormal hair coat yet, but maybe he has dental disease, maybe he has sinus infections and nasal drainage. So if we can kind of catch them over here before they turn into this, that's what we want to do. So this is why screening tests and yearly wellness examinations and making PPID diagnosis a component of that is so important. So again, I was talking a little bit about these animals that have converging endocrinopathies, or in other words, they're affected by both metabolic syndrome and Cushing's disease. And there's some interesting data out there to show that possibly those animals that have metabolic disease their entire life are more prone to developing Cushing's disease as they age. So we talked about inflammation that goes along with being obese. Well, these damages to the brain and the pituitary gland are actually oxidative stress and inflammation-related neurodegeneration. And so maybe if you have inflammation your entire life from being obese, then that might help, you know, promote this nerve degeneration within the pituitary gland and might lead to problems later on. These animals that have this thrifty phenotype or are very easy keepers actually appear to have a hyper-responsive pituitary gland as well. And it's possible that this chronic overstimulation, and we're not sure why this happens, but they could be linked with each other. And then that chronic overstimulation might eventually lead to outright dysfunction and Cushing's disease later on. But regardless of whether or not they're linked or whether they develop independently as two separate conditions, once they're in the same animal, you get worsening of the clinical signs, worsening of the hyperinsulinemia, because now you have several different processes that are disrupting metabolism. Okay, so these animals that are affected by multiple different things are probably the ones that are most at risk of developing laminitis. So an interesting point over here is aging. So as you age, the inflammatory status increases. And so that's due to a number of different things, including a decrease in lean muscle mass, increase in the proportion of fat to muscle, various different factors like this. But along with aging comes inflammation. Then we talked about how inflammation causes insulin resistance. So it makes sense that if you have an older animal that's already kind of prone to getting insulin problems and getting hyperinsulinemia, that if they then go on to develop Cushing's disease, it might be more easy to tip them over the edge and trigger them to actually develop outright hyperinsulinemia, which of course then puts their feet at risk of developing laminitis. Okay, so how are we going to test for all of this stuff? So one of the first things that we want to do is to make sure we're familiar with body condition scoring systems. So this 1 to 9 body condition scoring system is for horses, but there are that, you can apply this to donkeys. There are scoring systems specifically for donkeys. They take into account things like the overall obesity of the animals, and then deposition of fat here in areas like the neck, behind the ribs, at the tail head. And they are, on a 1 to 9 scale of you can safely feed about 1 to 2 cups of vegetable oil every day and add that to the diet to try to make up the calories. Things like beet pulp, some commercial low starch feeds, fat supplements, rice bran, things like that. But you have to keep the non-structural carbohydrate content or sugar content of the diet under 10% in these animals, even if you're trying to increase their calorie intake. Okay, and finally, our treatment for Cushing's disease. We hope that by treating the Cushing's disease with a drug called Pergolide, which basically normalizes function of the pituitary gland, that hopefully if we normalize that disease process and help that, then the associated insulin dysregulation that goes along with it will also improve. And so I would recommend, not only for the insulin dysregulation aspect of it, but also because of all the immune suppression and things that go along with Cushing's disease. It's a general welfare issue, so treatment with Pergolide is important. I kind of covered this already. And the other thing is that there's additional things that are important for these animals with Cushing's disease, and they're prone to getting infections, dental disease, heavy worm loads. So things like routine dental care, monitoring for any sort of infection, body clipping, appropriate deworming, vaccines, things like that are all very important. Okay, and the final thing is on farrier care. If people remember just one take-home message, it's that if you are working with a laminitic animal, it is a lifelong chronic problem. And so you want to find a farrier who likes working on therapeutic shoeing and these challenge horses. I have worked with farriers that have kept animals going that have almost no coffin bone left. It's almost been totally destroyed. Maybe 1/3 of the coffin bone is left, and yet these animals can be shod in ways by farriers who enjoy doing this type of work, and some of them can actually stay sound for a while. You eventually will lose the battle in some of them, but some of them can be kept walking for quite a surprising amount of time if you find a person that enjoys working with them. So the thing to remember is the hoof is permanently damaged, and so there's only so much we're going to do as far as realigning the hoof capsule with the underlying bone. So what we're not going to do with therapeutic farrier care is restore the laminar tissue. That's going to heal with scar tissue that's always going to be there. But the premise of shoeing these animals is to try to at least biomechanically trim the hoof in such a way that the biomechanics of the foot are restored, and you're having to work around that scarred laminar tissue. So again, it's a chronic process and it's a lifelong thing. So the basic premise of it is to trim off this excess toe over here and the excess heel. And if you can see, that takes this alignment from being divergent to back to being parallel, and hopefully normalizes the effects there on the hoof capsule. And this is the final point over here. I think that chronic laminitis animals sometimes, it depends their prognosis on how sudden onset the problem was. These chronic laminitic little donkeys can sometimes go on for quite a while. But again, eventually some of them do lose the battle with the pain management, or they develop very serious tendon contractures or things like that. So again, prevention is something that's a lot more useful than dealing with this problem once it happened. So you can see this hoof over here, there's almost no coffin bone over there left. It's about probably a half the size of what it should be. But again, sometimes animals like this with good farrier care can keep going for quite a while. But the thing is that the extent of recovery after a bad laminitic episode sometimes isn't known for up to 1 to 2 years. And you're talking about sometimes a $10,000 investment in that process over the rest of this animal's life. It can be actually much more than $10,000. You're talking about recurrent hoof abscesses, tendon contractures, stuff like that. So preventing this, again, is much easier than dealing with it once it's already occurred. Here are some resources if people want a little bit more information. And I will say also that this presentation, if you go to your WOVA app on your phone, there's a link to the PDF file of these slides. So if you'd like to download that as notes, you can go ahead and keep those. I would just download that while they're still available. And then there's some other websites over here for further reading. Any questions? So it doesn't correlate to what a scale would say, but as long as you're consistent using the weight tape from one measurement to the next, then yes. So, well, you get your starting point, and then you determine how much you feed based on the body condition score. So based on palpating those fat pads and the ribs and seeing how that looks. But then your starting point on your weight tape, so your weight tape might say 650 pounds, but the donkey actually weighs 550 pounds. It doesn't really matter whether they correlate the same or not, like a scale and a weight tape, but you make your mark on the weight tape, like I'm starting off at 650 pounds, and the animal, based on the body condition score, needs to say lose 100 pounds. That would be, maybe 3 body condition scores in an animal of that size. And so then that's when you just want to see that the trend on the weight tape is going down. So does that make sense? It's not an absolute value, but it's a good starting point as far as looking at the trend. They shouldn't be getting the molasses one. They should be fed the beef pulp without the molasses.
And they can have, that's what I'm talking about, is they can get the no molasses beef pulp.
Oh, you're talking about like a donkey who does not need to gain weight.
Yeah.
Yeah, so it's probably providing extra calories in the diet of that animal that are not necessarily needed. No more beef pulp, unless you have one of these skinny ones that needs to gain weight in a way that doesn't give them a lot of sugar.
Okay.
Yep.